everybody. Today we will talk about healthcare, Salesforce CRM, Health Cloud, and some challenges in modernizing the patient experience. Today on the show, I have Justin Hyun, a healthcare enthusiast. So let's get started. Hey, Justin. Welcome to Healthcare Soundbites channel. Very happy to have you here today. I know it's a Friday, so hopefully this is going to be a fun session. So Justin is a good friend of mine, very passionate in the healthcare industry and a great healthcare enthusiast. So I would love to have him on the show. So thank you for coming, Justin. So Justin, tell us a little bit about yourself and how did you land in healthcare and your passion for healthcare?
Hey, first, Vinay, thank you for having me on here. I'm glad to be your first guest on Healthcare Soundbites. Healthcare is definitely an industry that I'm very passionate about, it's four major verticals, right? But primarily, how did I get into healthcare? What's my background? I'm actually a Salesforce solutions architect. I've been working on the Salesforce platform for 10 years. Started at very different firms, different places, but today I work with you, Vinay, at Slalom Consulting. And I've been working on the Health Cloud platform, which is a new venture from Salesforce that's been a product that they've developed across the last 5 years.
Mm-hmm.
Originally, I didn't really have any interest in working in healthcare. I just kind of wanted to work on Salesforce. But as my career progressed and my experiences progressed, I decided to venture into the healthcare space. Primarily worked in a lot of different ecosystems and industries, right? Consumer goods, retail, higher education. But the main reason for my shift to focusing on healthcare was just societal impact. I had a friend from college called me up after a few years, and they had just asked me what I had been doing and how they felt. They wanted me to reflect on how I impacted society, and I realized I haven't really helped anyone, right? Just helped myself and helped the industry. But it was time for me to focus on a different avenue. And
Mm-hmm.
during that self-reflection period, Salesforce Health Cloud was released, and here I am.
Nice. Very very happy to know. And healthcare is a broader industry, right? We have pharma, life sciences, providers, payers, and med devices, new entrants. Is there any particular place you focus on?
I've done different projects in different industries, but my original foray into healthcare was in the provider space, right? Working directly with EHRs. Uh,
Mm-hmm.
did a couple of projects for different hospital systems across the nation and America. Then I was able to take the knowledge that I gained from that, from helping integrate EHRs to Salesforce, uh, and shifting my focus to med tech, so med devices specifically, and most recently into the pharma space. I
Mm-hmm.
think everyone will say that each industry is a little bit different and has different rules, but at the end of the day, my passion is for the broad segment that is healthcare and applying Salesforce to the industry solutions and paths, right? Um,
Right.
Salesforce
And
is a standardized focus.
yep, EHRs are fun, right? We see seen many providers, hospitals. Looks like a very complex screen. So, what is the role of CRM in healthcare? There are so many EMRs already that established from a long time. Epic, Cerner, eClinical, McKesson. There are so many, and they're also bringing their own CRMs. But what is the role of CRM as such, right? And Health Cloud specifically, what role does it play?
Yeah, I think that's a very good question. I also believe that EMRs are investing into the CRM space as well. But one of the most important things of a role in a CRM is really just understanding your customer. I think an EHR is focused on understanding your patient, right? And specifically the medical conditions of your patients and the diagnosis of your patient. When it comes to a CRM, it's about understanding their social determinants, right? What
Hmm.
activities outside of personal care are they engaged in? How do you reach a specific audience in a segment? I think, as you know, Salesforce is an industry leader in this specific space when it comes to CRM technologies, um, mainly because they built a technology that is really API driven, right, and data accessibility first. Uh,
Hmm.
while it is a system that is uh, um, quite useful and adaptable to a client's use cases. I think the most important part is there's a huge partner ecosystem that can leverage best-in-class solutions or add-ons and specific tailored industry solutions that can be built on top
Hmm.
of that platform. When it comes to specifically healthcare, just the addition of Marketing Cloud when it comes to the ability to engage and actively engage your patients and then essentially set them on journeys, right? When it comes to their care, if they're just coming in for a specific checkup and follow up, but making sure they understand what are the next steps in regards to diagnoses or in conditions. How do I put someone on a program or on a care plan? And
Hmm.
making sure I give them real-time communications as opposed to what typically happens, which is, if from my own personal experiences, I go to a doctor's office, they give me a diagnosis, give me some prescription meds, and say come back in 6 weeks, and no
Right.
follow-ups on whether I'm coming back or not. And sometimes those meetings are 15 minutes only, and that's it, right? How are you feeling?
Right.
So
And a long waiting time too.
yeah, definitely a long waiting time.
Right. So that's interesting. And what are some of the industry trends you see, especially with considering Salesforce and Health Cloud and overall, right? Like, how is this CRM making an impact?
Yeah, I definitely feel like it's the perception of the patient, right? There's a big shift from calling a someone who is looking for healthcare services a patient to calling them a customer, right? I think that's the most important avenue. It's not about whether your customer is looking for a specific care. It's about engaging your customer all across their journey, right, in their lifetime journey. There's people who go to a singular hospital system for all their lives. You know, their parents had appointments within that hospital system. They were birthed at that hospital system. They're going to be there,
Hmm.
right? And then their grandchildren and children are going to be there, right? So it's about understanding your customer. And I think the most important avenue is that we're seeing in the industry and the trends is that it's not just about how do I get someone into an appointment. It's about looking at the whole continuum of care. You know, some medical procedures take a longer period of time,
Hmm.
and there's different costs that are associated outside of your clinical care, right? You have people who go to specialized hospitals for cardiovascular procedures, and
Hmm.
they're going to be there for 6 months at a time. So the hospital system is not just focused on how do I treat this patient; it's how do I treat this patient's family, right?
Right.
Their patients are going to need lodging, right? So there are certain hospital systems across the nation that have acquired hotels, right? So that the hotels that are located directly next to their special surgery centers, so that when a patient comes in, they know that they have a place for long-term lodging, right? They can stay there for 6 months at specific rates that are provided to their patients. It's also
Hmm.
understanding the cost, right? Medical care in America is not cheap. We all know that,
Yeah.
right? So making sure
Absolutely.
that there's specific advisors and specific resources that they can send digitally, right? But also connect people through the role of a CRM to make sure that one, cost shouldn't be a barrier to your life, right? Making sure that a patient can live their life comfortably and making sure that they're getting the checkups. Unfortunately, that is not the case in many countries, but
Hmm.
that's where I see the industry trend shifting, and I see that's where the role of a CRM is very focused. Part of that, in order to
Hmm.
enable all those, is data sharing and accessibility. So, where I specifically see a lot of improvements on Salesforce and its specific acquisitions, such as API technologies, as MuleSoft, right? Specific industry solutions, Omni Studio.
Hmm.
Where I'm seeing a lot of a progression in industry space is making sure that the data that is hosted in specific platforms are accessible to everyone.
Got it. In terms of agent experience and Health Cloud being built on top of Service Cloud, how is it going to enhance both the experience of the patient as well as the
Dependent,
customer?
right? It's dependent on everyone's implementations, but I do believe Salesforce has more than enough industry solutions, and they're such an industry leader when it comes to contact center solutions that we know that the technology can work. It depends on how the technology is implemented, but I
Hmm.
honestly will guarantee you right now that in a hospital contact center, there's a lot of swivel chairing that occurs. There's a lot of accessing online Excel books. There's workbooks for information. There's a lot of accessing Word documents. There's uh, essentially people are working remote, especially in the day of COVID, right? So VPN technologies aren't as robust as they used to be, right? And there's a lot of implementations and a lot of investments hospital systems are making to enhance the agent experience. Um,
Hmm.
One of the best parts of Salesforce is, Service Cloud has been toted. There's been multiple Dreamforces, there's been the multiple wow factors. Um, Telehealth, right? The concept of telehealth and video services that was implemented in Salesforce over a decade ago, right? So while the technologies are improving to improve the solution, that all plays into the agent experience, right? Um,
Hmm.
Having a singular source of truth where you can have a omni-channel experience, whether you're taking emails, whether you're taking chats, whether you're taking phone calls. What it's been proven that the ability to not swivel chair or not look for your information, it vastly improves patient experiences and customer experiences. And so I believe while EMRs and EHRs are focusing on understanding those experiences, that's not what they specialize in, right?
Right.
Salesforce's product managers told immediately that we're not in the business of trying to become an EHR, right? We are in the business
Hmm.
of exploring and making our CRM system accessible to other platforms that don't necessarily focus on our area of expertise. I believe that's
Got
the beauty of a CRM,
it. Hmm.
and making sure that those experiences and the investments that an industry leader like Salesforce is making is being implemented across multiple facets of an organization.
Right. And today we hear artificial intelligence, chat GPT. It's so popular. Everybody is so pumped and hyped. Almost it's like a magic wand. How does artificial intelligence play a role in enhancing this experience?
Yeah, I think while it has a long way to go when it comes to a CRM, I do believe there's a lot of investment specifically on Salesforce's side when it comes to Einstein. Salesforce's artificial intelligence product is labeled and advertised as Einstein. But essentially, what it does is it takes data that is stored within your CRM. Again, data accessibility and sharing is the most important element, but it provides recommendations, right? Trends on saying if you wanted a patient to book an appointment or you want to reach out to a specific member, this is the best avenue and facet for you to reach out to them. These are the best times. They make recommendations based on the solution. I believe, in addition, there's certain technologies. I wouldn't say they're classified as AI, but there are chatbot solutions that help
Hmm.
mitigate the noise. Right? Where is this hospital located? What is the next best appointment? Right? These types of things can curb phone calls, right, and ensure that we're getting the phone calls directed to agents where it primarily matters, where there is a challenge in the solution, right? Challenge in the communication, whether it's a billing problem, whether it's a specific specialty care need, something that is a little bit more complex than I just want to, do my annual checkup or physical at a with a provider, right? So these investments in artificial intelligence, right, that Salesforce is making, it's toted every Dreamforce. It's kind of the focus in today's day and age. I think that's where it helps alleviate. I'm not going to say it replaces, but it does definitely help alleviate certain solutions that would take months of analysis for us to implement, right? Um,
Right.
like I said, disclaimer, right? You have to ensure that you have the right processes and trust your data in order to train these models and utilize the
Hmm.
solutions that are at hand. But I do believe it's about bringing the technology faster to an organization, right? And also making sure that your technology isn't making recommendations that are outside of the purview, right? So again, I said Salesforce definitely doesn't want to play in the EHR space. So I've heard
Hmm.
from their product managers, again, my personal assumptions, right, and hearings, but they don't want to get in a world where they're enabling propensity models, right?
Right.
Salesforce does not have the right data to recommend propensity,
Hmm.
specifically when it comes to healthcare and diagnoses. So they're dependent on um, integrations to the EHR to absorb those models, right?
Right. And you bring up a really interesting point that Salesforce does not want to play the role of an EHR. Like they're not into the clinical space, right? They're not clinical record system. However, I heard through one of the people in Salesforce that Salesforce Health Cloud can also be used without an EHR because it's a standalone system for smaller clinics. It can still be used, and they may or really not require a EHR. So, what are your thoughts on that?
I think there's a Salesforce is a solution that can be adapted for multiple industries, right? I think the bigger hospital systems and healthcare systems, Salesforce definitely does not have the right investments in play to make a dent in those industry spaces. But when it
Mm-hmm.
comes to small clinical clinics, right, clinics that won't invest in an EHR, EHRs are quite a hefty investment, but required. Um, there are places where Salesforce might be the right solution, right? We have
Mm-hmm.
seen Salesforce when it was first launched and designed for, it was a Sales Cloud and Service Cloud implementation. Those were the two primary focuses on the cloud. Um, but we saw that solution get adapted to multiple industries, right? Hotel
Mm-hmm.
chains, right? Telehealth, right? We've seen these industries go to retail consumer goods, automotives, right? Manufacturing. So um, to say that there isn't a market or a segment that Salesforce could play in, right?
Mm-hmm.
It's I would say that is too broad of a statement. But what I do believe is, if a hospital system has already invested in an EHR and there's a fine line where Salesforce would start absorbing clinical data, right,
Mm-hmm.
and becoming a replacement for that EHR. I think a lot of the industry speculation is that uh, individuals are worried that Salesforce will become a replacement for an EMR, and that is, again, from my knowledge, is not where the tool is going. Right? It's about
Mm-hmm.
providing data accessibility and sharing and leveraging all the best in breed tools. Um, but there are definitely clinics. We have seen some implementations where they could leverage from just cloud services, right? And I believe Salesforce can be adapted to meet their specific needs, right? At the end of the day, sometimes it's home care solutions, right? It's
Mm-hmm.
nurse triaging, um, but it's not necessarily a hospital system where I need to reserve surgery centers or specific beds and things of that sort.
Right. And in a nutshell, do you say we are moving from knowing the patients to knowing the customers?
Absolutely. I definitely believe that the implementation of or the noise and the barrier that Salesforce has burst through, right, has definitely opened some eyes to multiple companies, right? As companies that lead the EHR space, they've at least understood that if we just focus on the patient care, right, and we're isolated to a specific focus, right, we're not doing justice on our customers, right, and it's also the ability to understand your customer goes beyond just you know uh, other facets of clinical care. It's also understanding their trends, right? One of the biggest concepts that's coming into the medical space is an episode of care, right? We define episode of care as essentially when was a diagnosis made and how many times a patient has come back for that specific care, right?
Mm-hmm.
These are very important factors because at the end of the day, you're going to have patients who receive a diagnosis and a care plan. They say, hey, we need you to stop, lower your cholesterol, right? So you can't be eating red meats every day, right? And you got to really
Right.
focus on your diet and exercise. But if a
Mm-hmm.
patient and customer doesn't care about that, right, then they're going to be back into the hospital system, right? We're going to see an increased level of cholesterol, right? And then we're going to see other factors and side effects that occur because of this, right? This is where I believe a CRM system starts coming into play because it's not just about that one clinical care; it's about their interactions outside of
Right.
the clinical care and how it impacts the systems, right? And I think
Mm-hmm.
that's important, right? Because now you're starting to understand your customer, but we're putting value against it, and we're essentially saying we we understand that there are good patients. We understand there are bad patients. We understand there's good customers and bad customers, right? So we just need to be able to prioritize and understand where those customers fit into the spectrum and
Mm-hmm.
leveraging a CRM, right? And all the facets when it comes to integrations with other technologies, right? As well as the ability to do social marketing, right? Utilizing Marketing Cloud, it increases the value of the product and the impact that you're having on that customer's experience, right?
Mm-hmm.
Hopefully, hopefully that what that ultimately turns into is a better assessment and analysis of your customers and care, right? So that it's not about treat one customer, right, and then you're done with the product. It's about how many times did this customer come back, and how many times was that due to negligent
Right.
care, right, versus educating the customer.
Interesting. And when you spoke about integration, one thing came to my mind is like everybody wears a smartwatch. Most of them wear a smartwatch, and there's so much health, so many health parameters which is captured in a smartwatch. So can this be brought into the CRM? Probably, definitely not directly into the EHR, but maybe CRM is where it plays that role of housing that kind of a data. How will it play overall in making the patient engagement a really a fruitful experience?
Yeah, I think that that's a great question. I think that's probably where the biggest segment between a CRM technology such as Salesforce versus an EHR. Don't get me wrong, an EHR analyst definitely needs to understand how big data works, and understand, how they're going to analyze the systems and publish the data back and forth. But
Hmm.
there's a lot of different architectural patterns that are at play, and I feel like that's where Salesforce probably has a little bit of an upper hand, as well as a bigger ecosystem, right? I'm not going to say every Salesforce architect is truly enterprise architect, but most Salesforce architects have the ability or have been exposed to bigger scale projects outside of just a healthcare that allows them to analyze integration patterns, different vendors at play, migration tools, different migration tools at play, ZTLs at play, as well as different uh, cloud technologies, right? Are you going to store your data on AWS, right? Are you going to go with a Heroku approach? What are the solutions
Hmm.
Heroku offers on the Salesforce ecosystem? So ultimately, when it comes to solutions such as smartwatch integrations and how we're going to display the data, I do believe that a technology such as Salesforce has the ability to access that data, embed that solution, and
Hmm.
publish the data in a usable format where agents or specific tools and technologies can leverage that and say, hey, we need to trigger a notification, or hey, we need to reach out proactively. I think this is the most important thing, proactively to their customers as opposed to reactively, right? We have a lot of situations and a lot of customers that are, I just wait until someone puts in their new order. And I think the world and the systems, including healthcare, are focusing on how do I ensure that I'm being proactive and reaching out to my customer to say, hey, you need to order another set of insulin, right? Your
Hmm.
device is coming to its end of life. You need to put in another order and let us reach out to you, right? You're outside of your warranty period for this specific medical device, right? This
Hmm.
is where the world is striving towards, right? And smartwatch integrations and big data integrations is just a element of it. But I believe uh, uh, an industry leader like Salesforce, and the widespread knowledge that it provides,
Hmm.
has a little upper hand in that, right? And a little bit more teammates that are involved, where you can quickly implement solutions.
Right. Definitely a large ecosystem, right? So, Salesforce Health Cloud seems to be a no-brainer, but are there any competitors?
Uh, it depends on your use cases, right? So there are definitely some competitors that are out on the are in the systems, right? I would say outside of the EHR clinical care, when it comes to clinics and pharmas, for example, Viva is a well-touted solution, also built on Salesforce. But at the end of the day, it's a industry product that was designed specifically for clinical care and pharma, right? So it depends on what ecosystem that you're really or sorry, what industry and what vertical that you're referring to. But I would say that there are competitors. There are always going to be competitors. Depends on your price point. But what is a significant change from the last 5 years is I believe that Salesforce is now uh, acknowledging their lack of presence within the healthcare industry and multiple verticals within the healthcare industry. So,
Hmm.
provider being one of them, med devices, life sciences in general, right? And that's the challenge, right? That's the new focus for Salesforce, and we're seeing a lot of investment to it. So the competitors that used to dominate the ecosystems. They just have to uh, they have to deal with the industry player, right? There's a lot more resources and a lot of investments that Salesforce can make that certain competitors cannot, and how it depends on how niche of a solution or niche of a product that we're speaking about.
Yep, that's perfect. So, do you think we are heading in the right direction? And if there are any changes you think should be made, which you would like to share?
Yeah, I definitely think we're heading in the right direction, or at least that's where I'm putting my eggs on my eggs in the basket. So, um, I've really focused on trying to understand the healthcare ecosystem. It's complex. You could work in this industry for 30 years and you still won't understand all the facets of healthcare. Um, but that's where I put all my focus on, right? I love the challenges that it brings when it comes to Salesforce. As far as changes that I would like to see is I am focused on an industry where I think one of the biggest improvements is data sharing accessibilities, right? I think there's a
Mhm.
lot of red tape when it comes to healthcare, especially when it comes to privacy, right, and consents, right? We understand that. Where as a individual consumer myself, obviously I don't want my non-anonymized data being published to other places, but I always think about the greater good, right? Um, Thinking about less about monetization of that data, but how we can really change an industry, right? And change our generation by giving access to the data is the most important thing. There's certain API transactions, certain costs that it comes with enabling big data solutions, right? I'm hoping to see a change in the industry where it's less about monetizing. It's more about
Mhm.
where is my proprietal intellectual property in this. It's more about how do I change the focus for a generation and society for the better good, right?
Mhm.
I would love to make sure that that is. I see a lot of barriers when it comes to play, right? Certain technologies not willing to share their data. Certain cost just astronomical, right? That
Right.
won't play into a bigger solution. So you're very limited in the use cases you can serve to. Third-party data sources that are charging, um, you know, uh, absorbent contracts, right, to access their data that should be accessible to quite a number of companies, right? Because at the end of the day, we're trying to cater to the customer. That's primarily a change I would like to see. I'd hope that we don't become focused in an industry where it's all about monetization. How do I get paid for this, right? At the end of the day, you will see that the improvements in just AI, right? The ability to analyze X-rays, that's an example of where there's an AI technology at play where we're looking at pixel differentiations
Mhm.
at point. But imagine if every single charge, right, for that pixel analysis is just astronomical now, right? And so you're paying, a patient or a customer can't absorb the cost of paying $10,000 for that analyzation, which would say, hey, there's a difference in that pixelation where we identified a tumor, for example, right? That is not that is where I hope the industry doesn't go, right? And focuses
Right.
on making sure everyone has affordable care at the end of the day.
And that reminds me, like when I was growing up, people used to always tell me one thing: being a doctor or being a physician, it's a noble profession, just like being a teacher, right? It's being ethical and working in the best interest of everyone. Nobody said become a doctor or become a physician so you can monetize, you can earn a lot of money. It was always taught to me in a way that it's a noble profession. You're giving back to the society. So that resonates with exactly what you're saying. So before we wrap up our conversation today, you're a great leader, Justin, and you're a leader who produces more leaders. So what is that one piece of advice you would like to give for the aspiring consultants, and how can they jump from one orbit to the other orbit in their career?
Hmm. I think understanding where your passion lies, right? At the end of the day, everyone had to start somewhere, but it's when you realize that you have a passion for a specific industry, a technology, whatever your love and passion is, that's where you should be focused on. Um, I love Salesforce, right? I've live and breathe Salesforce, but most importantly, Salesforce has taught me a lot of skill sets, right, and a lot of understanding of different industries, right? It's never the same when you're on a Salesforce project and someone just pops you client to client, and all of a sudden you're an expert in a specific industry. So I think my advice to up and rising consultants is just understand your passion and understand that's what's going to drive you, and always be willing to learn, right? When I first entered the space in the ecosystem 5 years ago, I hadn't even been to a hospital. Like I hadn't had a surgery. I barely went in for check-ins. I didn't know what appointments meant. I didn't even know how to sign up for an appointment outside of calling the doctor's office, right? So focusing on where you want to analyze and your passion, that changed the whole spectrum for me, right? It changed my whole career path. So I definitely want to make sure that my one advice again is just follow that passion, right? It's an intriguing industry, and I've learned in the last 5 years, I think I've learned more than the last 20 years of just anything, right? Schooling, just getting first into the ecosystem. I've learned so much in the last 5 years, and I do believe that has elevated my delivery, my knowledge of industries and ecosystems, right? So I'm hoping that if you find that passion, right, then you will also be able to find that challenging industry for yourself.
Right. Passion is work. Work is passion, right? That's really
Exactly.
amazing. It was really nice. I really enjoyed the conversation and talking with you, Justin. Thank you for being on the podcast and sharing your thoughts.
Thank you. Thank you for
Thank
inviting
you.
me. I'm happy to talk about healthcare any day.
Thank you. And you have a great Friday and a great end of the week.